1/3 of Americans forced to cut spending or borrow for healthcare. Rising healthcare costs are pushing millions of Americans into difficult trade-offs, forcing them to sacrifice basic needs or take on debt just to access care. A recent survey reveals that roughly 82 million people, approximately 1/3 of the U.S. population, are already making significant cutbacks in their lives to afford medical expenses. Financial strain and personal sacrifices. The West Health Gallup Center on Healthcare in America found that 15% of Americans have been forced to borrow money to cover medical bills in the past year, while another 11% have skipped meals entirely. The situation is particularly severe for those without health insurance, who report making even more drastic sacrifices. These aren't isolated incidents. Nearly 30% of respondents delayed vacations, and over a quarter, 26%, postponed necessary medical treatments or surgeries due to cost concerns. The data also indicates long-term life decisions are being put on hold. Some Americans are delaying having children or retiring because of the financial burden of healthcare. The escalating crisis. This trend isn't new, but it's accelerating. A similar poll conducted in late 2024 showed growing fears among Americans about their ability to afford healthcare if they needed it. At that time, 11% reported being unable to pay for necessary medications or treatments, marking a 4-year high. The West Health Policy Center president, Tim Lash, notes that the situation is getting worse and is already impacting people every day in their decisions. This underscores the real-world consequences of rising costs on individuals and families. Context and implications. The survey was conducted between June and August 2025, meaning these figures reflect the latest economic pressures on American households. The rising cost of healthcare is driven by a complex interplay of factors: pharmaceutical pricing, administrative inefficiencies, insurance company practices, and limited price transparency. The increasing number of Americans forced to choose between healthcare and basic necessities highlights a systemic failure in access to affordable care. The trend is likely to intensify unless significant policy changes address the root causes of escalating costs. The findings underscore the urgent need for comprehensive healthcare reform that prioritizes affordability and accessibility for all Americans. If these conditions continue, the financial strain on individuals will only grow, potentially leading to further delays in care and worsening health outcomes.